We know there was some relief for the pharma companies because there was nothing on this in the Senate healthcare bill related to drug prices specifically. But what can you tell us about what the Senate bill means for doctors and hospitals?
You know, the most important thing about the Senate bill is that it takes insurance away from about 22 million people over the next decade. So for these groups that you mentioned, for doctors and hospitals, that's 22 million, fewer people who can afford to go to a doctor visit, who can afford to have a procedure done. And then obviously for the insurance companies, that's potentially 22 million fewer customers, and these are customers who would be shopping with government subsidies. So 22 million, fewer customers with, government help.
But at the same time, the insurers, or at least some of them, would get some money back as well. So it's not necessarily a losing proposition for them.
That's right. Overall, the insurance industry has been sort of mixed on this bill. We've seen some insurers come out in favor, some are opposed. And it comes down to sort of how they weigh this balance of, losing some of these customers versus, billions and billions of dollars in financial help over the next few years in the form of, some subsidies that are related to the Affordable Care Act and some about $50 billion in additional funding over the next few years as well.
So just give us a sense of what's going on with this ad campaign. We know that they've spent $1 million. How much reach, how potent is this for viewers looking at this and for ordinary people in America? Just what's the response?
That's right. So it's a 7-figure ad campaign from the hospitals. And what they're doing is they're essentially saying, are you at risk of losing your insurance? And so sort of prompting people to say, how does this bill, this debate in Washington that maybe I'm not paying that much attention to right now, how could it affect me? And so I think that's the kind of question that, over the next few weeks, folks are going to be asking quite a bit. They're going to be, as Congress goes into this July 4th holiday, people are going to be asking, this sort of complicated thing happening in D.C., what does it mean for my health care?